I think when we get to the disabilities, we've seen some moderation of the life rates coming down to more pre-COVID levels, but even still, there's all the pull forward of mortality, and we still haven't gotten back to where we should be. But we're seeing in the disability data that the rates of disability continue to rise, and we could see that from this data, the number of people with disabilities for people adults over 16 is up 5,000 people on disability, which is huge. It presents a great opportunity to identify these people early and reduce that risk through prevention. Now, looking more specifically at the workforce over age 16, we can see that this is up 35%. That's pretty huge, and it has a lot of implications for insurers and policyholders and the employers as well. So I have one client that's in the retail restaurant business that they've seen, for the same conditions that Josh was highlighting, their rates of disability are up 110% since COVID for those same conditions. They were offset by some of the other conditions being down, but that's a huge impact that it has on them, which highlights the opportunity for early intervention and prevention to keep workers healthy and productive, as well as policyholders to keep them off a claim. And this is going beyond just reducing claims, and it's about creating thriving workplaces and strengthening insurance portfolios for the long term. Globally, we're looking at German hospital data, and it's showing almost a fourfold increase in hospitalizations related to tricuspid heart valve diagnoses since 2019, with rheumatic cases accounting for about 15 to 20% of the total. And this trend began before COVID, but it certainly appears to have accelerated since. And this, I think, points to the growing cardiac health crisis. For one of my clients with over 100,000 employees, I've had the opportunity to review their claim data, and their claims in the top 4 categories increased 9 to 44% from 23 to 24. So this is still an ongoing issue, and particularly in the nervous and neurological area, it's up 44%, which is huge. In the heart and circulatory, I think has a particularly significant issues related to safety. So this slide highlights mortality from rheumatic tricuspid valve diseases, showing a rise from 1999 to 2024 that started a decade ago, but mirroring the German hospital surge as well. The non-rheumatic cases are excluded from here because they're of minimal impact on mortality. I have 2 clients with over 100,000 employees that both have seen 35% increases in their life insurance claims and premiums, reflecting the broader mortality trend. They are coming down, similar to what we're seeing at the broader trends, but they're still facing elevated mortality.